When you look at circulation, it's the passage of blood through various tubes in our body. So there are arteries which carry blood from the heart to the distant organs, like the big organs like the bowel, the liver, the brain, the kidneys, etc., and the peripheral organs, the legs and the arms. And then you have veins which carry the blood back up to the heart. So near the heart you have your lungs, which oxygenates the blood. That oxygenated blood comes to your heart, and the heart then pumps it down to the various target organs. The organs then use up the oxygen along with other nutrients which it acquires along the way, and then the deoxygenated blood, that is the blood without oxygen and without the nutrients and the waste products, is then carried back to the heart. This is a very complex system which is controlled by lots of different things, and unfortunately it is a very common problem to have where the arteries and the veins are affected. In fact, it is more common than all the cancers put together, and one way or the other is really the commonest cause of severe disability and death. If I split my work into arteries and veins, within the arteries you have two main problems. One is you get blockages in the arteries, so furring up of the arteries is the colloquial way of putting it, and this obviously means that the organ to which the artery is taking blood to doesn't receive the blood. It's a bit like a fuel pipe in a car. If the pipe is blocked, then the fuel doesn't get to the engine and the engine doesn't run. And it is a condition which is very common and forms a big bulk of what I do for arteries. So as an example, if there's a blockage in the artery, the carotid artery in the neck, then that can put you at risk of getting a stroke. And I deal with surgery to correct that blockage. Similarly, if you have a blockage in the arteries in the leg, which is common in people who smoke and people who have diabetes, then I deal with conditions where if you didn't improve the blood supply, the person would be at substantial risk of losing a toe or sometimes even a leg. The other major condition that you can get in the arteries is where the artery becomes too big, what we call an aneurysm. And that can affect any artery in the body, but the most common artery tends to be the main artery in the belly, which is the aorta. On the other side of the coin is the veins, which, even though they are not generally considered to be a life-threatening or a major medical condition, in a lot of people it can cause a lot of distressing symptoms, and in some people it can be bad enough to cause things like ulcers, and ultimately, if the ulcers are not treated, put the limb at risk. The condition that I need to treat most often is varicose veins, which is a very, very common condition. About a third of the general population have varicose veins. Unfortunately, we have very, very good and very simple, low-risk procedures to treat these varicose veins, and generally speaking, the results are very, very good. The majority of patients who present with varicose veins come because of pain, which isn't a sharp pain, but it is a gnawing pain which tends to get worse through the day. So when you wake up in the morning, your legs don't feel so bad, but as you stay on your feet for longer, the veins start hurting. And often people have to stop work halfway through the afternoon because they simply can't carry on because of the discomfort. As the situation gets worse, they can get swelling around their ankles, and that's because fluid accumulates around the ankle, and that fluid can be quite irritable, so you can get itching as a result of that. And then as the fluid and the itching gets worse over time, you can get a darkening of the skin, and ultimately if the skin breaks down, you can get an ulcer. The other common reason people present is when they have something called phlebitis. So the varicose veins, as most people are aware of, is a condition where you get bulging, tortuous, horrible looking veins which stick out of the skin. And the reason they bulge is because they're full of blood. And that blood is not getting up to the heart in a very efficient manner. So it remains stagnant almost within the vein. And similar to any body of water, if the water becomes too stagnant, it becomes full of, raw solid substances. And ultimately, it can clot off. It can just block off completely. And when that clot forms, it again incites a very severe inflammatory reaction, which can be extremely painful, far more so than you would get just with ordinary varicose veins. It's not an infection, it's just an inflammation. It's commonly misdiagnosed as an infection and treated with antibiotics. But in fact, it should be treated with anti-inflammatories like ibuprofen and naproxen, and often can be supplemented by putting stockings on to support that vein. It's, however, fortunately a self-limiting condition in that it lasts usually for about 6 to 8 weeks, maybe 10 weeks, and then settles down on its own. But once you've had phlebitis, it does put you at risk of having further phlebitis, because you will still have some residual veins, and the same process can happen again. And really, it's not something you want to face more than once. So if you have phlebitis, then that is one of the criteria which allows you to be referred on the NHS for treatment of those varicose veins. And finally, fortunately for us, rarely, the veins are full of blood. And as we get older, our skin becomes a bit more frail, a bit more thinned out. And sometimes even minor trauma can cause a lot of bleeding from these veins, especially around the ankle. And I think as anybody who has encountered anything like that will vouch for, it is extremely alarming to see a pool of blood on your living room floor or your kitchen floor. So in those circumstances, again, I think that you should certainly see your GP and get yourself referred for assessment of your varicose veins and potentially for treatment. And I would have absolutely no hesitation in recommending patients to come to Circle. The experience from the very start is completely different. Most patients who come to the hospital for the first time honestly cannot believe how lovely and open and full of air and light the hospital is. They often say that it doesn't feel like any hospital they've ever visited before. We take great pride in making sure they're looked after from the minute they walked in. The receptionists make sure that they're aware of where they are and whom they're going to see and where they're going to see it. From a medical perspective, you will always see a consultant. And as I've already said before, we are constantly peer-reviewed. Our work is constantly assessed to ensure that it's of the highest quality. And then you will have investigations which are appropriate, and you will have them very quickly.